Hello, everybody. My name is Dr. Melody Medley Keith, and I am with Lakeway Aquatic Physical Therapy. I am a physical therapist, but the way that we look at items and things that are going on with the body is we look at them through a biomechanical way. So today, our Snapinar is on claw toes. And for those of you that we've already had a lot of people responding to this saying, can it be from wearing high heels? Can it be from wearing your flip-flops all the time? And yes, that can be one of the reasons. We do know that there is sometimes a neurological reason, but what we're treating here today is really what we call a flexor toe extension. So what's happening is that the front of the ankle and the foot are getting so tight that they're actually pulling those long toe flexors in and curling the toes. So as always with our Snapinars, I always try to give you 2 or 3 great ideas that are going to help solve it. So what we're doing today is we've actually brought in a client, and she actually has claw toes. And so what we've been treating with her is trying to flex those toes and trying to move the toes a little bit. And you can just tell just from this one, this is one of her exercises, and it's just roller. She's actually putting the roll right on the med head and going to go in and trying to claw, trying to work on moving the toes even further into flexion. And you're going, wait, Melody, that's not right. That's not right. So we want to try to stretch it this way first. And you can tell she's kind of putting it on her toes. Perfect. Then our next one that we do is we just get a little half bolster, and you put the arch of your foot right in there, and again with pressure down into the bolster, she's going to try and curl the whole toes. I call this toes in the sand. Toes in the sand. And again, you notice that we're working into flexion because what we're going to do is come back and stretch all of these and stretch the knee. Because the toes, these long toe flexors come all the way up to the knee. So a lot of times it is the knee and the hip that's involved, as well as the midfoot, right? The arch of the foot and the hind foot. So that's where we want to work all of those. So these are good. If you don't have a bolster like this, guys, just use a noodle. You can use a pool noodle. We love pool noodles. And you're actually putting force into the midfoot and curling the toes. And again, like always, we want you to go 10 of these. 10 of these. Yep, nice and slow and controlled so that you feel that stretch into the toes. So then come over here. The next one that I'm gonna show you is just what we call the ankle ballet stretches. So now we're gonna work into the side of the foot. So you're just gonna put your foot on the inside. You notice I'm standing. I do want you straight. And you're putting the outside of the foot onto the ground. Oh, look, I just noticed my left sock's on my right foot. But for you guys, don't notice that. Patty's like laughing over there, going crazy. I know, sorry. I just noticed that. So this is invert, evert. Then we're going in. Yep, and you notice I'm nice and tall, and I'm trying to put the weight on the inside of the foot now. And again, I'm going to hold this a whole minute. Take a nice, good time to stretch this. And if you notice, I'm putting it on a little step, and I put a little squishy thing. You can always just use a pillow or something that gives you a little bit of fluff, because these are not going to really feel the best. Now, invert maybe, but evert is you're gonna feel that all in the ankle. So next one you're gonna do is just what we call plantar flexion stretch. So this is the one where you're going to start by putting the entire foot on it, not just the toes. So you can do your toes, but you want to try to get the whole foot. And if it starts cramping, you just come up, you go, and you kind of go back and try it again. And again, you want to try these 8 or 10 times a day. You want to get these. This one is a big one right here. This is what's going to stretch them. So we curled them. Now we're stretching the front of them. Good. And again, just stretching it out. Now, for those of you that have an incline, this is our incline stretch. And you can see it kind of goes up and down. We love this little board. You can get those on Amazon. And this is where we come in and we're stretching out the calves. And you want to stretch the calf with your knee straight and then with your knee bent. And with your knee straight and then your knee bent. And that stretches all that muscle up underneath the calf. Because as we said, when you have toe issues, the knee is always involved. As we say, hip bone's connected to the knee bone's connected to the ankle bone. And that's where we want to focus, is the knee and this. Now, you're saying, well, what if I don't have that? Of course, you can always go back to just a regular calf stretch, the old calf stretch here. All right, calf stretch. And again, you're going to hold this a minute. I'm really not holding a minute because we don't really have time to hold a minute. Or if you want a little bit more, you can go off a step and just drop the leg down. And that's your calf stretch. So, and while we're at devices, this is an ankle rocker. We really, really like the ankle rocker. We actually have people do both the ankle rocker and the incline to do these because although they're very similar, right, in what they do different things. And you'll see that when I get on to the ankle rocker here, and then I'm going to come here, and then we're going back and forth, back and forth. And all these devices, they sell online. Now, if you're like, I don't want to spend that much to try to see if these will work, then just get you a pillow, try the ballet stretches, try the roller stretches. You can get all this, find something out there that you can use. You don't have to have fancy, expensive stuff to do it. But if they become a problem, you're having a lot of pain, and you're still doing it, please remember that we want to try to get you out of your flip-flops. Try not to wear flip-flops too much. Try not to wear your Birkenstocks too much. Try to get in and wear some shoes that have a back to them so that you're not having to try to claw toe. And again, if you want to come in for physical therapy, what we also add is our Hyvamat and our dry needling. So we do a lot of dry needling. We've actually been doing dry needling on these to try to see if we can release some of that tension into the retinaculum, into that tension spot right in here to help release what's going on into the long toe flexors. So again, for those of you that have questions and comments, please put them in the comment. We do try to answer all of those. We like to know that what you're thinking about and what your questions are. We get back with you on those. For those of you that want to follow us, please push the like button, right? Ring the bell, and you will get notices on the next ones that we're going to come up. So we appreciate everything. We thank you for following our channel. And we'll see you next time on our Snap-N-Rs. Thank you very much. Bye-bye, guys.